What is trypophobia? Trypophobia is an aversion or strong discomfort to clusters of holes, bumps, or repeating patterns. It's not officially listed in the DSM, but research shows many people feel real distress when they see these patterns. Estimates suggest roughly 10 to 18% of adults report some reaction. Common physical and emotional reactions. Reactions range from goosebumps and itching to nausea or a sudden feeling of disgust. In one study, the most common responses were itchiness and goosebumps, around 2/3 of respondents, and nausea in over half. So this is more than just weird. Top trypophobia triggers. Now, the triggers people ask about most? I'll describe each, show a safe blurred or animated example, and explain why it often causes discomfort. Lotus seed pods. Lotus seed pods are the classic image people mention. The clustered cavities are visually striking and commonly trigger strong reactions. Honeycombs and beehives. Natural repeating hexagons like honeycombs also trigger many people. The regular repeating holes can look ominous, even though they're harmless. Sponges, coral, and porous textures. Host. Everyday textures, kitchen sponges, coral, or some fungi can catch people off guard because of their porous patterns. Foods with pores, pancakes, crumpets, strawberries. Oddly, some foods with many air pockets or seeds, like certain pancakes or lotus seed-like fruits, trigger reactions for some viewers. Skin-like clusters and medical images. Host. Images that resemble skin lesions, rashes, or parasites are the most disturbing to many. Because these can resemble disease cues, they tend to provoke the strongest disgust or fear. Again, we won't show graphic medical images here. Why these patterns affect us? Scientists offer two main explanations. 1. The visual system. Some trigger images have a particular contrast and spatial frequency that overstimulates vision. Research using spectral analysis found these mid-range visual frequencies are common in trypophobia-inducing pictures. 2. An evolutionary or disease avoidance idea. Clustered patterns can resemble skin lesions or parasites, provoking disgust to help us avoid contagion. Can you measure it? Researchers developed a short, validated tool called the Trypophobia questionnaire. It helps measure how strongly someone reacts and separates trypophobia-specific discomfort from general anxiety. If you want to understand your reaction, that's a reliable starting point. Quick coping tips. If you're triggered, try these safe steps. Look away and ground yourself. Name 5 things you can see, 4 you can touch. Breathe slowly. In for 4, hold 2, out for 6. That calms the autonomic response. Reframe the image. Think of it as harmless texture, not something biological. For persistent or severe distress, structured treatments like CBT and graded exposure can help. Clinicians use controlled, gradual exposure and cognitive techniques to reduce reactions over time. When to see a professional? If reactions cause real distress, interfere with daily life, or lead to avoidance, like skipping foods or places, consider talking to a mental health professional. A short assessment can point you to CBT, exposure therapy, or other supports. That's a safe look at the top trypophobia triggers and why they bother so many people. If this helped, like and subscribe and tell me in the comments which trigger surprised you most. If you want a follow-up, I can do a science deep dive or a coping tools video.